Great, thank you very much, and good morning, everyone. I'm really sorry that I cannot be there with you, but I'm here talking to you from Brussels. It's an honor to be able to participate to this meeting and also provide you some of the findings of our work when it comes to the potential of artificial intelligence in social services. So, as already mentioned, my name is Konstantina, and I'm head of policy at the European Association of Service Providers for Persons with Disabilities. In the meantime, I'm also sharing my screen so you can see a small presentation that I have developed that can support you and support me as well to walk you through some elements that I believe that are important to bring in the discussion today. Before diving into the topic, it has already been mentioned, but just like to reiterate what the EASPD is, and we are a leading voice of disability services across Europe, and we gather and represent more than 20,000 services for persons with disabilities across 50 different countries. Our mission is very clear. What we are trying to do is that we are trying to develop systems of support which are of high quality, which are effective, that can promote the human rights of persons with disabilities, but also provide them with equal opportunities to live independently, to participate equally in the community, in employment, in education, and so on. So our work focuses on different areas, as our members as well work on different areas. And what is essential for us is to support in what we call this transformation of services for persons with disabilities towards more person-centered, more human rights-oriented, but also based in the community type of services. So we work in different areas, as our members also work in different areas, such as, of course, we will discuss today about AI, but also our members work on person-centered technology, which, as the name calls for it, is how we can provide technology to persons with disabilities that it's closely linked with their individual needs and can support them in their day-to-day lives. But we also work on independent living, on legal capacities and supported decision-making for persons with disabilities, on education, employment, but also looking on social services themselves and discussing and exploring the development of the workforce, human resources departments within social services, but of course we focus on policy impact, but also equal access to arts, cultures, and sport. So you can see that we have a vast areas of interest and of work. We mainly work in advocacy and policy development. For example, we contribute and we try to improve policies within the EU, but also on a national and regional level. We also provide and explore innovative practices. We also provide, we contribute to research and also on how we can deliver quality support, but also we offer access to peer learning opportunities. So our members can learn from each other. And since we are a community of more than 20,000 services for persons with disabilities, so we offer a lot of connections and this type of peer-to-peer exchanges. why we are working on AI and what was a little bit the rationale behind this decision. Of course, we have been working for many years on person-centered technology together with our members, but now artificial intelligence is knocking our door, as it's happening within different sectors. And also, since we are based in Brussels and we are a European network organization, this is one of the main strategic goals of the EU artificial intelligence. And of course, the EU is quite ambitious in this regard, as they want to become what they call an artificial intelligence continent. However, for us here, what is important is that both we see AI, of course, the social as a social imperative, and to explore the social impact that it can have for persons with disabilities, but also for people of other support needs, like older people, people with mental health conditions, and so on. But also, we identify that the potential of AI in social services can also be a strategic investment into the EU's priorities on competitiveness, because the EU has new priorities since the recent European elections, and of course competitiveness and how we can make Europe more competitive, it's among them. When we talk about social services, first and foremost, we talk about their impact, and that is about supporting people in vulnerable situations to live independently, to be autonomous, but also supporting the quality of life of millions of people across Europe. But at the same time, social services are also a key economic driver. They are part of the social economy ecosystem, and they are considered one of Europe's largest employers. So they don't only offer support and care to people with disabilities and other disadvantaged groups, but they also provide jobs, they provide training, they provide innovation, and so on. However, we also talk about a sector which is underfunded for many years now, but also under-digitalized. Unfortunately, social services are not considered within the strategic sectors where digital innovation can take place. And unfortunately, this means that social services do not, of course, they do not even have appropriate funding and sustainable funding in order to operate. So when we are talking about innovation there, of course, you see more difficulties to access funding that can actually support this innovation part. But from discussion with our members, from a study that we recently did as well, and quite some exploration on the topic, we see that artificial intelligence can also provide services, new avenues, as we say. It can support to improve the quality of care. It can support to improve the efficiency of the organization, support the workforce in their day-to-day tasks, further support the coordination of different services, but also improve the accessibility of services themselves. And of course, this is about social services, because we have seen what it can offer for persons with disabilities, older people, but other people as well with different support needs. Our goal, when we are talking about the potential of AI in social services, of course, our goal is on how AI can improve autonomy and social participation of every individual that is supported by social services, while respecting their dignity. And for sure, I think that this is quite important to highlight due to the fact that there are a lot of concerns regarding discrimination, discrimination, bias, potential risks in using AI. But at the same time, for us, it's important as well to really also point out some of the benefits that the AI can bring in social services when, of course, is designed and operationalized in the right way. So, of course, for us, what is important is that this is a tool that can support and not replace human contact, because we know how important human contact is between the person supported, but also the professional, which is in the other side. So, for this reason, we are calling for a human in the loop approach, which actually what does it mean is that AI cannot be developed if there is not someone doing controls, checks, and in a co-development way together with both social services, but also persons with disabilities, which are the end users also a lot of times of these technological advancements. So it is essential, this can be quite essential in order to ensure that we will develop, that AI can support in developing an ethical and empathetic service delivery. We have identified some benefits which stem from the fact that we already see AI used in social care and support. And what we see for persons with disabilities is, of course, that it can support them to increase their independence and assist them in daily tasks and daily routines. Most of the systems that we see that are implemented in this regard have to do with tools that are speech to text or text to speech applications which can support with communication. But also we see that there are AI technologies are used via what we call smart home devices. And for example, they can support people to control the lights, to control their washing machine, or like set voice reminders, which can be quite beneficial to improve autonomy, further increase autonomy in everyday life. And for social services, some of the benefits that we have already identified is with tools that can reduce the administrative burden. We actually hear a lot of times from our members that, and we see as well that the workforce, a part of supporting people and having this like human contact and human interaction with people, they also have a lot of back office, as we call them, tasks like reporting, taking notes, among others. And being a social worker myself and have worked in the field for almost 10 years before moving to a different role, I have seen that firsthand. So we currently see tools that can facilitate this work, that can help with managing data and with keeping records, with assisting with scheduling. But also we see that there are tools that are currently being developed and tested, which can also help to develop personalized care plans for people with disabilities, take notes and do part of the reporting, which of course is a huge help for the frontline workers. So here are 4 priorities that we see on why artificial intelligence actually matters and needs to be further explored on how it can support the sector. And that has to do with different elements. And of course, the first one is that we see that it has the capacity to support in providing more person-centered, improving person-centered support towards people with different support needs. As I mentioned previously, there are tools that are developed and tested which can support in creating what we call personalized care plans. Of course, these are are always to be reviewed by both the supportee, but also the person that is supported. AI can play quite a big role in analyzing notes, in analyzing reports that can actually help in this task. For us, it's quite important to always talk about the workforce. So we see virtual assistants, we see chatbots, as we call them, that can actually increase efficiency in the daily tasks of the workers, the frontline workers, but at the same time, while at the same time also reducing administrative burden. For us, this is also quite an important point because at the moment we have a lot of staff shortages in the sector, and many times we talk about a sector that is not that attractive, and one of the reasons can also be the fact that it does not, it cannot, not does not, it cannot, even if they want, it cannot utilize it so much innovation and innovative tools such as AI tools, which of course can have an impact on how attractive this can be, especially for younger workers. Because at the same time, in our field, we also see that the social care and support workforce is also aging. So it can be, AI can also actually further increase the attractiveness of our sector and bring more people as workers, as care workers within it. Different tools like assistive technology devices have already been used by persons with disabilities in order to support their daily life. But what is important is that when these are used and embedded also to service systems that are inclusive, that are person-centered, they can really further expand, improve accessibility, improve independence of persons with disabilities, and support their full participation in the life, in the community, which of course is within EU's commitment on the UN Convention on the Rights of Persons with Disabilities. Last but not least, social economy. Social services are part of social economy, and social economy actors are often pioneers in user-centered innovation. So if there are the right funding instruments, if there are the right regulatory frameworks, that means that they can really use AI in order to further improve their ability to offer community-based services, person-centered services, and services that respect human rights. Of course, we also need to talk about challenges, and there are a lot of challenges. Usually, most people start from the discrimination, bias, and lack of ethical standards part. However, I thought to start from access to funding, since this seems, like quite a challenge, and I'm sure that. However, this doesn't mean that this is like a prioritization list, but I just wanted to also point out that there are other challenges that we need to take into consideration. For example, we see a lot of financial constraints. This means that we have AI tools that are great. Thank you very much. So I will just cut it back from where I left it. So we were here. So I was talking about the challenges, and this has to do with access to funding. Access to funding is difficult, especially when it comes to innovation, due to the fact that the social services sector, unfortunately, is not considered as a sector. It's considered as a sector that is low tech, that is non-commercial. So that affects a lot the funding, access to funding in terms of innovation. So what usually happens is that we see social services and persons with disabilities that rely in tools that we call off-the-shelf tools, which means that these are tools that can be used generically by anyone without at the same time have appropriate accessibility features. So, of course, their impact is limited and as it is not adapted to the specific needs of the people. And there is a high cost in developing tools, but also maintaining tools and providing tools to people and social services that are tailored to their needs. And unfortunately, there are no funding instruments that have been quite pivotal in supporting this type of innovation in the sector. Then we also need to take into consideration the lack of digital skills in the sector. And this is among both the management of a social service, the service provider themselves, but also it has to do with the sector, I mean the people, the workforce that are working within social services. We also see that currently in social services there is an aging workforce, which research has shown that digital skills and digital proficiency unfortunately decreases with age. So that's also something that we need to take into consideration, as well as very important to also discuss with the workforce, as a lot of times there are concerns regarding AI replacing jobs or AI replacing human contact. And it's very clear for us that AI should be used as a tool and not to replace the human aspect of the sector, which is crucial. Then this comes a little bit in conjunction with my first point, that AI tools are not adapted to all disabilities. They are not developed together with persons with disabilities and service providers. They do not have all the necessary accessibility requirements, or they are not developed with what we call a universal design in mind. So this actually leads to using tools that cannot be effective, as they cannot take into consideration the real life, the real experiences of persons with disabilities. Then we see that there are different levels of awareness within the sector. So especially when it comes to privacy, when it comes to risks. So our consideration here and recommendation is that a social service provider cannot move forward with deploying an AI tool if they have not raised appropriate awareness within their workforce, within the people they support, within the families, before adopting any tools. And last but not least, which is very important, is also elements that have to do with bias, discrimination, and lack of ethical standards. I think that we are quite familiar with this term. So in this case, I just wanted to offer an example that we identified. For example, there is an AI tool that has been developed, and you can use this tool in order to plan leisure activities. And what we saw with this tool is that when it was flagged that the person has a disability, then actually this algorithm stopped suggesting activities. So here, for example, we see that the outcome was quite discriminatory, and that within this tool there was the bias that if you have a disability, then that means that you cannot participate in any leisure activities. So there was no training, if we can put it like that, of the algorithm for adapted or inclusive alternatives when it comes to leisure activities. So I think that's quite an interesting example for you to be aware of regarding this challenge. When we talk about AI, it's not simply about the innovation that comes with the AI, the technological innovation, but we need to really embed AI within social services following the principles of human rights, equality, accessibility, co-design, and social inclusion. Lastly, because I see that the time is passing, we believe that AI can be used and has a potential within the sector, but it needs to always involve people with disabilities, but also service providers in the design, in the testing, in the deployment, and in the maintenance of the different tools. For example, we see in general, we see that this is not the case in AI tools based on a study that we did, but we identified a good example where there was a communication tool that was developed together with people with a specific syndrome, which is called the locked-in syndrome. And actually, we saw that this co-design approach it had a great impact on the usability of this tool, specifically for people with this type of syndrome. So this showcases that we need to use this co-development type of approach more, especially when we talk about people with support needs and service providers. Then it can, there are a lot of tools that are already being used, like assistive technologies, in order to strengthen accessibility. But here AI can play an even bigger role. And an example that I can showcase from our research is that, for example, there was a tool that was simplifying documents that were administrative for people with disabilities. So it was providing them in an easy to read, easy to understand language, and that actually empowered the people to understand their rights, but also to be able to participate more actively in the design of services, in the design of their support plans. So here it is not just about accessibility, it's about strengthening accessibility even more. We have already discussed extensively, I think, about that, but it's important to also mention it here, how AI can actually be used as a support tool for the workforce. This automation of back office tasks, and there are tools that have already been used. I have a slide later, which I will not present you to lack of time, but this can be shared with you so you can see the different examples. So, for example, there are specific tools that actually are supporting the workforce in reducing administrative tasks, and that means having more time to provide one-on-one support to the people that they are supporting, people with different needs. However, here, in order to further harness the opportunities, we need also to invest in building the capacity, building the skills of the workforce. Of course, we need EU investments in this regard. And this is the reason why also EASPD has been doing so much work on this topic, because we have this like AI, apply AI strategy that is coming from the European Commission. However, we see that social services, unfortunately, are not part of the discussion. So for us, it is really important for social services not to be left out, because as a sector, we are already, there is a gap between sectors, and we have a quite wide gap when it comes to the use of artificial intelligence, but also technological advancements in general. And if we are not part of this strategic orientation of the EU when it comes to AI, of course, this will increase a bigger gap between different sectors. But in order to do that, we also need alignment with regulations, and there is already an artificial act coming from the European Union, which does not address social service providers and persons with disabilities concretely. So it will be important to take this element, this sector, but this target group into consideration. And lastly, social services are part of what we call small, medium enterprises. We see that, for example, in 2024, there was only a 13% adoption of AI tools in small, medium enterprises and enterprises within the EU. So we see that this is a sector that needs more investment and more support from funding, but also regulations. So here are some good practices that we have collected. Of course, due to time constraints, I'm not going to go into there, but you can see here the different tools that we have seen being implemented in different countries and how which can be considered as promising, not good practices. I would put it more as promising practices in the sector. And here are some additional resources, work that EASPD has done, which based on these resources, I have prepared also my presentation for you today. And here as well, some information for you on how you can get involved with EASPD if you are interested to learn more about our work on artificial intelligence or any other topic. So thank you very much, and I will be very happy to take any questions if we have the time. Thank you.
Preguntas en el idioma que queráis, ¿vale? Tenemos micro. Por aquí.
Hola, Egunon. Yo quería hacerle una pregunta en relación a una de las ventajas que ha dicho, que la IA favoreció, vamos, que tenía capacidad para realizar planes individuales más personalizados. Si podía ponernos algún ejemplo, agradecería.
Hello, and thank you very much for this question. Indeed, we have identified some specific examples. For example, let me open as well my slides. We have, there is a tool that is being used. This tool is called Magic Notes, for example. And of course, it's not the only tool, but it's just the first one that comes in mind. So this tool helps the social worker, which is actually while having a conversation regarding the support plan of the individual, so they take notes. They can identify also the tone of the person, but also the narrative. So it seems that it can also reduce potential bias that might be coming by the professional themselves. So it can actually generate and take automatically notes, which then can feed into the development of a support plan. But of course, this is always being done with the support worker as well, and the person with disability and the AI tool working together. So as mentioned, it's important to always have this like human in the loop approach, as we cannot just trust an AI tool in generating personalized plans, personalized support plans. But indeed, we have AI tools that are currently tested and used, which showcase which show quite a lot of promise.